Doctor, please, what causes diabetes and how do I prevent diabetes? Hello, everyone. Just in case you're meeting me for the first time, my name is Dr. Unique. I'm a Nigerian trained medical doctor currently practicing in the UK. Today, we'll talk about diabetes and how we can prevent diabetes. I want to say a very big thank you to all of you who always repost my video, like and share them. A lot of people have been giving positive feedback about how my videos have helped them. So please do well to continue sharing this video, like it and repost it to help someone know about diabetes, or help someone having symptoms and doesn't know about diabetes to know about diabetes. What is diabetes? Diabetes is a long-term or a chronic medical condition that affects how your body uses sugar or how your body metabolizes sugar, that is glucose. In normal people, when you eat food, your pancreas release what we call insulin, and insulin, take all those food that has been converted to sugar and are in your blood. Your insulin takes them and give them to your cells, all part of your body, including your brain, to utilize and give you energy to do your normal daily activities. In people that have diabetes, it's either they have problems with producing insulin or they have problem with responding to insulin. There are two types of diabetes. You have the type 1 and type 2, as well as the one we call gestational diabetes that happens to pregnant women, as well as the one we call pre-diabetes, which is a situation whereby someone is almost getting diabetes but hasn't gotten the diabetes. Now, for type 1 diabetes, the problem is that there is autoimmune, it's an autoimmune condition that somehow affects, the production and release of insulin. So type 1 diabetes is not about what you eat. It's not about because people don't get it because they eat so much, they eat so much sugar. It's about the fact that they can't produce insulin. So please be empathic when you hear people have diabetes. It's not every diabetes that is a result of people have eaten so much sugar. And type 1 diabetes actually affects young people, can affect children, it can affect young people, okay? Whereas it can affect any age. Whereas type 2 diabetes tend to affect people who are obese or overweight. Now, what are the symptoms diabetes will give you? People can have increased or excessive thirsty, excessive drinking water. They can have uncontrolled weight loss despite having adequate appetite. And they can also have what we call excessive tiredness. They can start having problems with the vision, blurring of vision. They can have, problems with their nerves, feeling pains in their leg, as well as ulcers, difficult to heal. Now, what can you do when you have diabetes? When you have diabetes, first of all, or you're having any of these symptoms I've listed, you need to go to the hospital and your blood sugar will be checked. If it is type 1 diabetes that you're having, it means you'll be needing insulin for the rest of your life. And you have to inject insulin. So anyone that has type 1 diabetes, not about don't eat, because if they are children, imagine like I told you that type 1 diabetes affects even children. So you cannot tell a child to stop eating, they have to eat. So it means you have to take insulin based on the things you're eating and at each time that you need to eat, and then monitor your blood sugar every time. But if it is type 2 diabetes, it depends. Are you still in pre-diabetic range, meaning you've not developed full-blown diabetes? For people that have pre-diabetic range, when they change their lifestyle, reduce sugary food, lose weight, exercise, and start eating food that have what we call, low glycemic index, not like all this processed food, they start being able to control their sugar and they may not develop full-blown diabetes. But if you've developed diabetes also, we can also manage it with lifestyle, like I've said, lose weight, eat healthy, be active, as well as also introduce diabetic medications to help control the blood sugar. Why is controlling your blood sugar very important? It's important because uncontrolled sugar can prone you to a lot of complications. Those complications include heart attack, stroke, okay? Yes, some people don't know that diabetes can also prone them to have stroke. So you can get heart attack, you can get stroke, you can get eye damage, what we call diabetic retinopathy, you can get peripheral neuropathy, you can get kidney damage. So diabetes can damage every part of the body. There are people that can also develop, the food moving very slowly in their tummy, what we call diabetic gastroparesis. So there are a lot of complications you could develop from diabetes. Please like this video, repost it and share this video today so that someone that have diabetes or getting signs of diabetes but don't know can get it. And if you have any question, I welcome your questions and I'm happy to answer them. Thank you so much. Bye.